Hey there, my name is Mandy Beth and I'm your board certified family nurse practitioner, and I wanted to give you a few health tips on eczema. So the medical term for eczema is going to be atopic dermatitis, and it's characterized by patches of red and very itchy skin. Usually eczema is commonly seen in the pediatric population, although it can continue on into adolescence and adulthood. It's just more commonly seen in the pediatric population. The good news is that eczema often resolves on its own in the late childhood ages. So think about, anywhere from 5 to 8 years old. Eczema is going to be found on the flexural spaces of the body. So think about the bends of your arm, the bends of the knees, the back there. And in infancy, it is common to see eczema on the face and the extensor surfaces of the body. So think the tops of the arms, tops of the legs. Typically in infants, if you have a rash that's in the diaper region, it's not going to be eczema because eczema usually spares that diaper area in children. There are various causes for eczema. There are a lot of genetic links with eczema. If there's a lot of allergies and asthma and eczema in the family, then oftentimes a child is at higher risk of developing eczema. And some studies have even shown that children who have chronic exposure to hard water develop eczema more readily. So, for example, if you live in a city or town where the water is hard, lots of calcium carbonate in the water, you might want to consider getting a water softener system, and that could improve you or your child's eczema. Just some various tips on eczema, ways that you can help make it better or prevent it from getting very bad. You want to avoid really hot, steamy showers or baths, as that can dry out the skin more. You see, eczema is caused by a epidermal barrier dysfunction. So there is a lot of moisture loss, and the dry skin can often, if it cracks or oozes, it can lead to infection. So taking less baths is sometimes recommended because you're not drying out the skin as often. Now then, if you are exhibiting symptoms of a skin infection imposed on top of the eczema, you definitely need to bathe daily. Another thing you might want to consider is some studies have seen that adding half of a cup of bleach, or about 120 milliliters, to a full bath of water can actually prevent some of the skin infections that do occur with eczema, and it also reduces inflammation. So bleach baths are often recommended for people or children who have eczema. You need to make sure and use emollients and moisturizers whenever you get out of the bath or the shower. That's when your skin is the most moisturized. So make sure and apply an emollient or moisturizer that's thick, unscented, no fragrance is very important, all over the body. Usually with eczema, there are specific patches that are very dry and itchy, and on those patches, it might be very good to use an ointment. Ointments versus, say a lotion or a cream are going to be more occlusive, and they provide more barrier protection than just your regular thick cream. So using an ointment like Aquaphor on those really dry patches might be really helpful. If the skin is really itching and inflamed, there are some over-the-counter options such as hydrocortisone. It will come in a cream, or you can use the ointment. I would use the ointment if it's very dry and itchy. As I said, this is going to be more occlusive as well. You'll want to watch out for infection with eczema. So for example, you have this, dry, itchy spot. It's got a crack in the skin, and it is more prone to infection. So if you're experiencing, spreading redness, it's getting tender, and if there's any type of purulent or pus-colored discharge, then you need to be seen by a medical provider. Oftentimes, as I mentioned, eczema is very itchy, so you want to block that histamine release by taking either a non-sedating, or you can take a sedating antihistamine like Benadryl close to bedtime to help control some of that itching. Eczema is usually limited again to those childhood years, but it can continue on into adulthood. Anytime you're, around excessive areas that might cause dryness, like the winter time, or you're outside more and you're getting more allergies, sometimes these things can flare up your eczema. So just make sure and do that good hygiene where you're not taking hot, steamy showers and baths. You're lotioning very well. You're applying ointment to the areas that are trouble spots. And follow up with a medical provider if you have any questions about your eczema or it doesn't seem to be responding to the normal treatment. I hope that this information has been helpful for you, and I hope that you stay well.